What's up, everybody? Welcome to the Health UnMasked podcast. I'm your co-host, Karl Pilz, and here with me is your other co-host, Dr. Eric Ginter, also known as Dr. G. How's it going, Eric?
Hey, Carl, how's it going, man? Beautiful day today.
Yeah, it is another beautiful day. We've had a monsoon of rain, which is kind of odd for this time in North Carolina, but hopefully that's over. It's nice outside today.
Yeah, I mean, it's some of this rain has been literally torrential, you know?
Yeah, right. So, okay, let's talk today about things like why everybody is so tired and things like depression and ADHD and eating disorders and all these things because they are all tied together at what I consider to be their base. And my contention is that, 80% of these cases of all those things can be fixed, if not made way, way, way better if you understand where a lot of this stuff comes from. Okay, so Eric, do you see anything in your clinic about people like just coming in because they're exhausted or because they're depressed or anything like that? People get, patients coming in talking about that.
I'm getting a lot of people coming in talking about general fatigue. I'm getting people telling me they're just kind of feeling they don't really have a lot of motivation either,
Mm-hmm.
you know? But the people that are generally between like 40 and 60 years old, I'm getting a lot of folks like that coming in and just saying, I am just tired of living this way, tired of being tired,
Mm-hmm.
and I just feel like I'm getting run ragged, you know?
Yeah, right. Yeah, I was looking up some statistics, and what's crazy is that let's see, in 2022, 18.5% of women in the United States were taking antidepressants. That's a huge number, and it's growing. And there's another statistics where what percent were using it long term. Okay, so 60% or 68% of people age 12 and over taking antidepressants use them for 2 years or more, and 25% use them for 10 years or more. That's a pretty insane number.
It really is.
Yeah, and
And it's not stopping because they don't have any other tools for it.
no, and I think one of the biggest problems is that general practitioner doctors are allowed to, prescribe these medications when they're not qualified. They weren't trained in, the same things that like psychiatry and psychiatrists are. Even though I have serious problems with those professions, they're not trained to diagnose, what problems could be underneath. They just get a patient that comes in and says, "Hey, I'm really tired. Here's an antidepressant." It's like,
Yeah.
did you really dig into that at all? Because you don't like it. My beef is that if you go to the doctor and he gives you an antidepressant, you ask him what this SSRI does, he'll tell you it makes your body produce more serotonin. When that's not at all what it does, because he doesn't know how it works. All he knows is what he's told by his pharmaceutical sales reps.
Right.
So yeah, so this is a big problem, and I think that we need to kind of shed some light on this. So what I tell people, and I've had a lot of people that have done this, and they've gotten to the point where they realized that hey, they always say don't get off any medications without talking to your doctor, and I think there's a lot of politics and stuff like that behind that statement. But just to cover our butts, don't get off your medications without talking to your doctor. But I've had a lot of people that do what we're about to talk about, and they say, you know what, I no longer feel like I need them anymore. So I did talk to my doctor, and I was able to stop. So the basis of where this is coming from, comes from the idea of how neurotransmitters are made in your body. Okay, so neurotransmitters are things that we've all heard of. Like serotonin was one of our big neurotransmitters. Serotonin is your neurotransmitter that makes us feel confident, and we can take on the world, and we're calm, we can focus, all that stuff. Serotonin, when our levels of serotonin are high, that's how we feel. Adrenaline is another neurotransmitter, and that gives us our mental energy. So when you drink caffeine and you use that to get energy, one of the things that caffeine does is it raises your stress hormones, and that includes adrenaline. And that gives you energy and focus, because what that brain chemical is supposed to do is, if you're running from a tiger, you're supposed to have all this energy so that you can get the hell out of there. So adrenaline is another one. Our endorphins that make us feel fantastic. Though that's another neurotransmitter. And so when our body is making these transmitters at an optimal rate, then we feel fantastic. We feel calm, we feel confident, we feel like we can do anything that we want, and we have the energy to do it. And we enjoy ourselves a whole lot better. So when you have this, your body creating this, this buffet of neurotransmitters properly, then you feel fantastic. The problem is most people are not doing this, or most people are doing things that are sabotaging the process of your body making these neurotransmitters. Okay, Eric, did you have anything to add at this point?
No, absolutely. And a lot of it comes from the destruction of the gut, because a lot of those neurotransmitters are made in the gut.
Yeah, right. So okay, the process of how these neurotransmitters are made. Okay, these neurotransmitters come from amino acids, and these amino acids come from proteins. So a protein like a steak or chicken or something like that is a protein, and that protein, when it gets digested, it's broken down into individual amino acids. Amino acids like tryptophan and tyrosine and phenylalanine and all these different amino acids that you've heard of a bunch. I mean, you can go to GNC and get pills for a lot of these amino acids. So these amino acids, when we eat like a steak, our body will break it down if we're digesting properly, which we've talked about before. But if we're digesting properly, that steak will get broken down into individual amino acids. Then those amino acids will go into our body, and they will combine with things like vitamins and minerals and things like that. And then our body will produce these neurotransmitters. Like tryptophan, the amino acid tryptophan is what makes serotonin and melatonin. And the amino acid tyrosine is used to make adrenaline and dopamine. So this is how these brain chemicals are made. So these chemicals are made in our gut, a lot of them, and then they hit up to our brain and they make us feel fantastic. And they do all kinds of other things in your body. So that's how these brain chemicals are made. And if you're doing things properly, giving your body the protein that it needs, then your body will make these neurotransmitters and you won't have any problems with being tired. You'll have all the energy that basically you need. And it's amazing when you get this all figured out. It's amazing how like your life changes. Because when I was growing up, I mean, I had bouts with, I wouldn't call it severe depression, but I would get down on myself pretty hard. And, I would lack energy and all this stuff. I was falling asleep in class when I was, in grade school and high school and college. I was always falling asleep in class. And when it really got to the point where I felt like I needed to figure this out, I started looking into how all this worked. And I was like, oh, I'm shooting myself in the foot by the way that I'm eating.
Yep. And one of the other things too is when you start producing those chemicals and having that energy, you start doing things. And one of the major drivers of anxiety is knowing that you could be doing more or better and you're not doing it.
Yeah.
So that side effect of the energy and being able to get things done will be something that will help the anxiety as well.
Yeah, that's why, this is one of my favorite topics to talk about, because I really think that once you figure this out and once you start getting a handle on this, your life literally changes in a huge way.
Yeah.
So you start you start being able to do all the weight loss stuff and all that stuff that you want because you have the energy.
Yeah. And one of the things we talked about before is about going carnivore. Mm. I mean, that's one of the things that's really helped me too in that same regard of energy and just feeling better and, mindset and things like that, because I was getting the protein required to break down to make the amino acids to turn into the proper neurotransmitters.
Yeah, right. Yep. So let's talk a little bit. So if we're eating enough protein, that sounds like it should be enough. But let's talk a little bit about how people sabotage this, because not everybody, but most people are doing this. So if you get your body the protein, then it'll break it down into individual amino acids, and then, neurotransmitters will be made. But if you're consuming sugary stuff or a lot of white carbs or whatever, and that causes blood sugar spikes and crashes, then you're sabotaging your body's ability to produce these things. Because when your blood sugar spikes, your body will release a lot of insulin to remove that excess blood sugar from your bloodstream. But the problem is, along with it, insulin will also remove all those amino acids from your bloodstream. And so now those amino acids are not getting turned into neurotransmitters, and your brain is not getting those neurotransmitters that it needs to feel fantastic. So sugar and white carbs are one of the biggest culprits. Not the only one, but that's one of the biggest culprits. And when you switch to, even just eating a diet where you're eating whole grains, like 100% whole wheat bread, 100% whole wheat pasta. We eat chickpea pasta, and that tastes just like noodles when I was growing up. Nowadays, it's gotten so good that, there are plenty of very palatable options to stay away from sugar and white carbs these days, that people should be able to do this relatively simply.
Yeah. And to build on that, when you talk about the blood sugar spikes and the drops and the spikes and the drops, that's actually more dangerous than someone that just has high blood sugar most of the time.
Mm-hmm.
And so when you're developing that insulin resistance, you start seeing your A1C at 5.7, 5.8, 5.9, 6, like that. That's the red warning light on your dash that you're starting to develop some cellular protection mechanism. So to tie that to what we're talking about, when we're developing that resistance in the cell, well, we're not able to bring that glucose into the cell. We're not turning that into ATP, which is energy as well.
Mm-hmm.
So that's another thing that just kind of adds to the story here.
Yeah, right. There's an awesome book that I read years ago called The Diet Cure by a woman named Julia Ross. And that was a mind-blowing book for me. She talks mainly about eating disorders. And, because there's a ton of girls, not only young girls, but this is happening to young boys now, where they're developing eating disorders because they're obsessed with being so skinny because of all the TikTokers and Instagram stars and all that stuff that are showing them what, bodies supposedly are supposed to look like.
Right.
And she talks about how when you go down this route, when you start eating a lot of sugar and white carbs and you start not giving your body the ability to produce these neurotransmitters, what happens can literally warp the image that you see in the mirror. So so this is how it usually goes, according to that book. Let's just say a girl starts being concerned with her weight, so she stops eating. Well, one of the things that she stops eating is meat, because meat has fat, and I'm trying to get rid of fat. And everybody was convinced that, fat causes you to get fat, which was a lie. So she stops eating the proteins. And what does she replace that with? Usually some type of carbs, or they starve themselves. And I knew a lot of girls that flat out told me, they said, yeah, when I want to lose weight, I just stop eating. It's like, okay, yep. Well, what happens is, you could do that if you do it long enough to go into ketosis and you stay away from carbs, then okay, you could do it. But what happens most times is they'll starve themselves, and then after a day or so, they'll get so hungry that they reach for cookies. Yep. And then you got blood sugar spikes and blood sugar tanks and all that stuff, and you're making things worse. So what happens over time is, as these kids deprive themselves of more and more protein, they're depriving themselves of more and more neurotransmitters. So their serotonin in particular, the serotonin level will get so low that it literally warps the image that you see in the mirror. And that's why she says that's why it's so hard to get girls out of this cycle, because when your serotonin is that low, it will literally warp the image that you see in the mirror. No matter what you say, no matter how you say, you're not fat, the image that she sees in the mirror shows her that she's fat. It's like a funhouse mirror,
right?
When your serotonin gets that low.
Yeah, and the kids are so active nowadays with practice and their other activities that they're doing. They get home from school, and from there they're on the go until 9:30, 10 o'clock at night.
Yeah,
so,
right.
If they're on the run and they don't have a sit-down meal where they're getting the protein, they're going to go to the gas station and get a sticky bun and a Gatorade or something like that.
Yeah.
And it just kind of builds on itself. And
the parents too will get into that rut.
Yeah.
That's a lot of people run themselves really crazy with the sports, and you got to do some planning to make sure that you don't fall into this rut, because it's really easy to start eating food on the go and start, the avalanche of these neurotransmitters being either destroyed or not created, and now things get perpetually worse because you start getting tired, you start getting irritable, all these things. Yeah. So what was interesting was, in that book, Julia Ross, she has a clinic where she helped people with this. And the thing that she would do was she would sit down a client. She would say, what's the worst thing that you're feeling right now? And the client says, okay, I'm tired. Well, she would give her a pill like that you can get at GNC of L-tyrosine. She would give her that pill. And she would wait 15 minutes and she would say, okay, now how are you feeling? And she would say, well, I'm not tired anymore. And she would say, oh, okay, now what's your worst feeling? She's like, well, I'm just so gloomy. Then she would give her a pill of tryptophan. And because tryptophan is what makes serotonin. And she would wait 20 minutes and say, how do you feel now? It's like, I'm feeling better. And that's how she would basically wake people up and open their eyes to, yes, this is what's happening, and these pills that I'm giving you are food.
Right.
They're synthesized versions of it, but basically when you eat protein, you're getting all these different amino acids to make you feel fantastic. And that's how she would wake people up. That was a great book. That Julia Ross, The Diet Cure. If anybody wants to go look at that, you can get it on Amazon. But absolutely wonderful book for any parent of any young kids now, not just girls.
For sure.
So that's my contention is that, 80-90% of people that are tired or depressed or even have ADHD or whatever, because when you have low levels of serotonin and dopamine and all these things, your behavior just goes crazy. And so if you have kids that have behavior problems, then really take a look at how they're eating and see if you're falling into this category of sabotaging these neurotransmitters being created. Because all these kids getting labeled with ADHD, there's no blood tests saying, oh yeah, look at this chemicals high, he has ADHD. That's all just looking at the kid and taking the word of the parents about how they're acting. And then they get this label. So a lot of it might just be that your neurotransmitters are shot and your blood sugar's crashing all the time.
Yep. Yeah. I mean, think about the kid's typical day. They get up, they eat Lucky Charms before school.
Yeah.
Or they have a toaster strudel or something like that, right?
Yep.
And then they go to school and they open up their lunch, and everything in their lunch is in a little bag.
Yep.
From the box that makes it convenient for the parent just to pack lunches so easily,
Yep. That was my issue. Looking back, our parents, when we were growing up, they were sold, that was the generation that was sold convenience foods.
Yep.
And they would said, yeah, it's just as healthy. Just eat this box food and all that stuff. And so we were sent to school after eating turnovers or pancakes or Honey Nut Cheerios or something like that was just loaded with sugar. And no wonder I was falling asleep in class and getting...
And the gluten too. Gluten's huge, right? I mean, that's what starts creating the holes in the gut from the glyphosate. And the problems just get worse and worse.
Yeah, right. So, so you were telling me some stuff before we started recording on a cellular level. What's starting to happen?
Yeah. So, I mean, if you start developing insulin resistance, that's a clue to you that the cells are protecting themselves. They cannot bring any more glucose inside because of all the metabolic waste inside the cell. The mitochondria are exhausted. And when that happens, you're not able to produce that energy. Mm-hmm. You're not gonna take the glucose and turn it into ATP, which is the energy for our body to run.
Yeah.
So there's so many different levels. We're really touching surface level here, but there's so many different levels to what can cause people not to feel well in terms of being exhausted, depressed, or anxious,
Yeah, right. Because all these same processes, the blood sugar spikes, and we talked in one of our other podcasts where you mentioned that not only looking back in history, not only was it the increase in carbs that started correlating with all these increases in diseases, but it was the chemicals, the industrialization of everything, and all the chemicals that are now in our food supply. Once you start down this road, I mean, you pick up something at a gas station, it's going to be laced with chemicals. So once you start down this road because it's convenient, then a lot worse stuff than, being tired is on its way. So it's highly in your interest to get this sorted out. And like I said before, if you go to the regular grocery store, I mean, we go to Whole Foods a lot, but even if you go to the regular grocery store, there's so many. I mean, Ezekiel bread is the stuff that we use, and that's available at basically any grocery store. And, the chickpea pasta, that's also available at any grocery store. So the availability of stuff that is good is pretty, like, light years different than it was when I first started doing this and started looking for, whole wheat alternatives and things like that. Back then, we were eating sticks. We were eating twigs.
Right.
And today, there's a lot of good alternatives. It's just you have to start putting the time and the importance behind getting all this sorted out, because it's not just you, it's your kids. I mean, think about when, if we have kids that are labeled ADHD and we're the parent and we're the ones feeding them, I mean, we have to accept that that diagnosis is largely our fault. I mean, a lot of parents don't understand that this is how it works, but now you do. And so now it's your job to get this settled for your kids, because when you feed your kid horribly and you put them in a depressed state or an ADHD state, I mean, you're changing their life for the worse. So, but when you say, okay, I got to get this handled, and you start moving towards moving towards fixing it. Now you're giving that kid, you're getting that kid set up to be happy, literally happy, those feelings of being happy for the rest of his life. And there's not
Yeah.
really a better gift that you can give your kid as a parent.
Yeah, and most likely, if the child is feeling that way, the parents are feeling the same way because they're eating the same stuff
Yeah, exactly.
and doing the same stuff, or not doing anything,
Yeah.
you know. And then you start developing stagnant lymphatics, and you're not clearing anything from your body.
Yeah, well, and that's a lot of people tend to say, oh, it's if they have a health condition, whether they're overweight or different health conditions. Oh, it just runs in my family. It's like no,
Yeah,
maybe a little bit, but a lot of what's happening is that habits and eating patterns and things like that are what's passed down from generation to generation,
right.
and so that's why
Right.
certain things are more prevalent in your family.
Yeah, and I think a lot of people they almost accept the diagnosis of ADD or ADHD because I'm getting a lot of adults too that are like, "Oh gosh, that's my ADD or that's my ADHD."
Yeah.
I've got that, and it's just seems like some people are almost defeated as soon as they get that type of diagnosis. It's like,
hmm
"Oh, well, that's what I got."
Well, and it goes back, one of the things that's important to get is the protein because you need the building blocks of the neurotransmitters. You need to stay away from the quick digesting carbs, but also the minerals, like we've been talking about forever. Those minerals combine with those amino acids, and so if you're not getting the minerals, then you're also not going to be able to do it. So getting the salt and the minerals is part and parcel of making you feel fantastic. That's why all this fits together. And when you don't do it, it leads to everything crappy. But fixing it is always comes back to like you got to do this.
Takes some work. Yep, it takes some work, and it takes some. You have to give yourself some grace too. You're not going to figure it out in a week.
Yeah, right.
We're trying to give concepts and things like that will help a lot, but you don't have to kill yourself, so to speak, with the way you change your diet. You still can go out and enjoy yourself in the evening on a date night or something like that.
Yeah.
But if you're doing this 90% of the time, it will pay dividends.
Yeah. Yep. Literally, like this is why I try to focus people on this because once you realize this and start changing it and seeing a difference, your whole world changes. Like it's nothing short of your whole world changing. And
Yeah.
I think it's the biggest gift that you can give to anybody.
Yeah.
So there's a woman who goes to I take my kids to CrossFit, and there's a woman whose boy also goes to that CrossFit class for kids, and the kid looks like he's around 14 years old or something like that. And the woman and I were just sitting there, and she asked me what I did and started talking about this podcast, and she started talking about her son was put on ADHD meds, antidepressants, and she wanted to get off of them. And I was like, well, I explained all this stuff. I was like, look, you got to work with your doctor, but this is how this works.
Yeah.
And after talking to that woman, we sat there for about an hour, and I told her first thing is get minerals in. I was like, if you guys aren't taking minerals, first thing to do is get minerals in and start focusing on protein and start whittling off the carbs. It's tough to get kids off of carbs quickly, so you got to do it progressively. So just do that, and I think you're going to see some changes. Don't mess with the medications right now, but I think you're going to see some changes. And she came in, let's see, I saw her again, what was it, 3 weeks later? And I was like, hey, how's your son doing? She goes, I saw it. She's like,
Yeah.
I got the minerals. I've been trying to back off she was like, he's fighting me on the carbs a little bit, but I'm trying to do less. And I added the minerals and more protein. She was like, I saw it. He's not fighting me as much.
Yeah.
And I was like, crazy. I was like, you're doing great. Just keep doing it. Add more as much as you can. Don't start fights. Don't push it so hard that you're starting a ton of fights, but do it little by little. And then you're going to start seeing the changes. And so now, I mean, was it probably 3 or 4 months since I've been, going to this CrossFit class with my kids and, seeing her. And I saw her last week. She was like, I keep seeing it. She was like, he's getting more and more receptive and listening better. And we're having less fights, and he's less all over the place. So she's like, what you're doing is working. And I told her, I was like, look, you're doing everything right. And I said, one thing that you have to realize is going down this route is going to be lonely because you're going to be surrounded by friends and other parents who are going to tell you that this stuff is garbage and what you eat doesn't really matter that much because a lot of people are defending their own behaviors and they don't want to give up what they're eating and they don't want to admit what they're doing in their life is wrong. So going down this route, it can be lonely. I was like, just know that you are doing everything right for your kid and you're going to make his life better. And she got a little teary eyed and everything, but once you see this, especially for your kids, like sometimes parents won't do things for themselves, but they do them for their kids. Once you see this wake up in your kids, everything changes for them. And if you take them along for the ride and explain to them what's going on, and they, latch onto these concepts and it anchors it in their minds, you just set them up for the rest of their life, understanding how to stay out of this mess.
Right. And that can go through generations and help the health of their family,
Yep, we do this with our kids. If my kids are throwing a tantrum, which happens very rarely, but sometimes, like if we're bowling and they're shooting some bad frames and they just lose it sometimes, I'm like, what did you have for breakfast? Then they get wide-eyed and they're like, oh God, we didn't have protein. And all of a sudden they run to their box and they grab the sausage or salami or whatever that I packed for them and they start eating it because they know 20 minutes later they're going to feel fantastic. And they're acting crazy like right now because they didn't have the protein or they had too many carbs.
Exactly.
So anchoring that in the kids' brains at a young age, I think is one of the best things that you can do for the kids.
For sure.
Yeah.
Yeah. It's good stuff.
So yeah, if you go to my website, truthandjalapenos.com, I have a bunch of free guides. One talks about why I'm always tired. One talks about how to feed your kids to excel in sports, because we touched on that a little bit. So all those free guides are there. Eric has a bunch of free guides there. He has his 21-day inflammation reboot. That program is going on right now. His website is modernhealthinstitute.com. Eric has a bunch of free guides on his website also talking about inflammation and his zone therapy technique that he uses. So that's all there at our websites. You can go to the podcast website, which is healthunmasked.co, and you can find links to both of our websites from there.
Sounds good.
Yeah.
Good talk today.
Yeah, good. Definitely a good talk. I think gauging by, where I came from growing up, and I was so anxious. I was like, especially around girls, I was so anxious and unable to move and things like that sometimes. And I was always tired, getting in trouble because I was sleeping in class and all that stuff. And once this got worked out, things changed big time.
Yeah. We've got to move away from the convenience and do a little bit of work, and it definitely pays dividends.
Yeah, definitely. All right, man. Good talking to you, and we'll talk again soon.
All right, Karl. Have a great day.
You too. See ya.